Meditation. Aging is associated with increased arterial stiffness, high blood pressure, hypertension, and vascular dysfunction. Vascular dysfunction represents an important risk factor for cardiovascular disease. Regulation of vascular function and high blood pressure status is mandatory to prevent future adverse events such as stroke, heart failure, and myocardial infarction. Similarly, aging is associated with high inflammatory status and oxidative stress. The advancing age associated elevated inflammatory status has been reported to coexist in both subclinical and clinical status of cardiovascular disease, including hypertension and vascular dysfunction. Epidemiological studies showed that the presence of chronic low grade inflammation status can contribute to future development of hypertension. Decreased nitride oxide NO availability and increased inflammation and oxidative stress are reported as key element in the impaired endothelial function, which is associated with advancing age. Decreased nitrite, nitric oxide level can lead to change in vascular tone by increasing arterial stiffness and blood pressure in older adults. In recent years, complementary mindfulness based meditation therapies and practices have become increasingly popular as strategies for a variety of cardiovascular risk factors. The term mindfulness refers to a conscious modality characterized by a state of mental presence and attention to the present moment. Mindfulness based techniques teach the capacity of discriminating thoughts, emotions, and actions with the positive effects from those with harmful effects. Growing body of evidence from mechanistic and clinical research. Studies have demonstrated favorable effects of the mindfulness based meditation practice in decreasing cardiovascular risk factors such as hypertension, lipid peroxidation, and hyperlipidemia, and atherosclerosis. Mindfulness based meditation is an old meditation practice rooted in Buddhism, and it is widely practiced among Buddhist monks. Buddhist mindfulness strategies, including Buddhist Vipassana and Anapanasati breathing awareness meditation practices, have long been associated with spiritual development. Mindfulness based stress reduction is a technique developed by J. Kabat-Zinn in 1979, which is drawn on old Buddhist meditation practice, but adapt these practices in systematic way to suit Western cultures. The Buddhist meditation approach is composed of concentration on the breath, anapanasati, or mindfulness of body, sensation, mind, and mental phenomena, satipatthana, or calm abiding, samtha, which can lead to the subsequent relaxations. Breathing awareness meditation, which is comparable with Buddhist Anapanasati meditation technique. Concentration on the breath is widely used as in practice as lifestyle modification approach for the management of hypertension, and literature suggests positive effect on this approach in blood pressure management. Recently, there is promising data available to suggest that Buddhist meditation based intervention may provide beneficial effect on chronic inflammation, cardiovascular risk factors, including vascular endothelial dysfunction and high blood pressure in both elderly and younger participants. Mindfulness is a process involving awareness of the present moment experience. Two major forms of mindfulness based practices are samatha, focused attention, and vipassana, open mentoring, open monitoring, choiceless awareness. In the practice of focused meditation, attention is placed on a dynamic automatic stimulus such as breathing. With increased experience and expertise in samatha, there is a natural evolution to vipassana, which involves meta awareness of sensory, effective, and cognitive events. Mindfulness meditation is a fairly loose term that applies to many meditation practices, which have been found to improve a wide spectrum of clinically relevant cognitive and health outcomes. In patients training in mindfulness improves self-reports of anxiety, depression, stress, and cognition. Mindfulness related health benefits are associated with enhancement in mechanism supporting cognitive control, emotions regulation, positive mood, and acceptance. Mindfulness has been described as non elaborative, non judgmental awareness of the present moment experience. However, one does not need to be practicing or even be trained in meditation to be mindful. Varying degree of trait mindfulness exists in the general population. Outside, outside of any formal training, mindfulness can also be developed with mental training routines such as meditation, and there are a variety of different practices that are subsumed under the general rubric of mindfulness meditation. Thus, it is critical that the specifics of the practice being taught or employed be recognized. Here, we will focus on two rather coarse categories of mindfulness practice, namely focused attention, samatha in Pali language, and open monitoring in Pali language vipassana, both of which are centered on developing a number of distinct cognitive skills. During focused attention or samatha, the practitioner is taught to develop cognitive control and attention stability by training to sustain focus on moment to moment quality and characteristics of sensory, emotional, and cognitive events. In brief, samatha involves direction one's attention to the dynamic nature of the chosen object of meditation, most often the sensation of breath or body when attention drift from the object of focus. For example, to a distracting sensory event, the practitioner is taught that to acknowledge the event and disengage by returning their attention back to the meditation object. Often, samatha is thought as a series of distinct practice, increasing in complexity, mindfulness of breathing, emotions, and thoughts. While samatha practices aims primarily at gaining mental control and stabilization of attention, they naturally lead in a somewhat ambiguous way to the trait associated with the open monitoring meditation. As a developmental derivative of focused attention practice, the mindfulness practitioner almost naturally transitions into an open monitoring mental stance, also known as vipassana. It is believed that extensive training in samatha is required before the open monitoring aligned cognitive stance develops naturally, whereas samatha open entails focus on a single dynamic meditative object Open monitoring practice are more inclusive of perceived thoughts and emotions. When applied to the full extent, these practices are associated with a non directed acknowledgement of any sensory, emotional, or cognitive event that arises in the mind. While practicing open monitoring, the practitioner is said to experience the current event without evaluation. To this extent, mindfulness meditation has been described as a state of non present or non elaborative mental stance.